Hey, it's Bram Duffee, and welcome back to class. Today, we're going to be talking about the media and its effects on health. And to do that, we have to have some framework to size that up with. And so, today, we're going to be talking about the mix up of health communication theory and also understanding about media. So, a media theory, healthcare, this is where we're going today so that we can better understand this whole realm. So, at its core, a theory is a tool for understanding and interpreting reality. It provides a framework that helps us make sense of the world around us. And in health communication, theories guide the creation of messages, the selection of communication channels, and the evaluation of communication efforts. They're all things that are the backbone of our practice, planning, and research. But at the same time, some might argue that a theory is something that is safe for everybody. It proves and disproves to be the work in progress to what's actually happening. This kind of perspective suggests that theories are static and just furnished pieces of work. But in reality, theories are much more dynamic and evolve. And this involvement happens with new insights and new evidence. And they're all simultaneously a work in progress. And so it's much more of that than a finished product. It's like we constantly examine this and challenge this and refine this by researchers and practitioners both. So there's a widespread belief that medical journals and research funders are mainly concerned with practical, factual research and not with the research that develops theories. And this viewpoint assumes that facts and theories can be separated, that theories aren't necessarily practical or useful, and that engaging with theories means developing them. But let's just debunk those misconceptions because all thinking involves theories, whether we realize it or not. Our perceptions and our interpretations of the world are things that are shaped by underlying theories. You don't need to read academic texts about theories before using them, just as you don't need to read texts on reproductive medicine before having a baby, right? Theories are embedded in our everyday lives. And at the same time, theories are integral to the scientific process. They help inform questions that we ask and the methods that we use and how we interpret our findings. Because theories powerfully influence how evidence is collected, analyzed, understood, and used. So examining them is both practical and scientific. Also, theories are not just about development, but also about application. So applying theories to real world problems can lead to practical solutions and interventions. And so in health communication, theories can help us design more effective campaigns and understand health behavior and hopefully improve health outcomes. When we looked at the media effects on health that were introduced in chapter 13, they listed a bunch of theories. And I want to be able to take each one and spend time explaining each one and giving an example so that we can have it out there to work with in our class and in our environment of thinking. So let's start with agenda setting theory. Agenda setting theory is something that suggests that the media shapes public discussion by highlighting certain issues more than others. So during the COVID-19 pandemic, for example, media coverage made the virus the main topic of public concern, demonstrating the power of media to set the agenda for public discourse. So that was, sort of one example of agenda setting theory that we can think about. priming theory is something that further explains how media can influence our knowledge and priorities. So when we think about priming theory, for instance, when news coverage focuses on heart disease, it's often something that is going to emphasize the risks of unhealthy eating, and this prompts audiences to consider their diet, whether when thinking about their heart health. And so this effect was shown in a study where viewers were exposed to specific news topics that were able to later rate those issues as more important. So that's why we think about the priming theory. It's kind of like injecting information that gives some influence. Another theory to mention is called framing theory. And framing is another critical concept because it refers to the way that media presents issues and how these presentations shape our understanding. So if media frames obesity as the result of personal choices instead of considering socioeconomical factors, then audiences are likely to adopt that perspective. And so the language and the context used by media can significantly influence public interpretation. And so that's why we think about framing, because framing, it refers to how media presents something. Cultivation theory is something that suggests that repeated media portrayals shape our perceptions of reality. Is this beginning to take notice in your mind about some examples that you've had? You know, if you have a TV show that routinely depicts doctors as infallible, then that can lead viewers to develop unrealistic expectations of healthcare professionals. This theory highlights the long-term effects of media narratives on our worldview. So cultivation theory, if you think about cultivation, I think about planting, we think about over time that this comes through. And so this is something that's easy to think of, lots of examples to attach to. The social comparison theory is something that suggests that people assess their success or their failure by comparing themselves to others. And that includes people that they see in the media. So, for example, if there's a fitness influencer on Instagram, they might make users feel inadequate about their own bodies because that's what would influence the self-perception and the body image. So social comparison theory is something that that stands out as a commonly considered theory relating to teenage kids, because they do all this comparison of themselves, right? But that comparison is hyper activated because of their awareness of themselves that's happening at that stage. But nonetheless, social comparison theory is really powerful, and I'm glad that we thought to mention it. Also, the knowledge gap hypothesis is something that predicts that educated and affluent individuals gain more from media information. And so that widens the gap between different socioeconomical groups. So for instance, those with a higher education level might better understand complex health articles. And that understanding is going to increase the disparities in health knowledge, because one group understands and knows and the other group does not. So this knowledge gap hypothesis is something that can explain dynamics sometimes. Also, communication inequality is something that refers to varying ability of social groups to assess and to access and use the same information. So wealthier communities often have better internet connectivity and have a better, easier access to health information, and so all these things can contribute to greater health disparities. Media misinformation is also a significant issue, and as false health information can easily spread through media channels, it's important to think about how, like in the 1998 example, the MMR controversy kind of took wind. And the MMR vaccine controversy is where a false study was there that linked the vaccine to autism. And this caused vaccination rates to drop and preventable diseases to resurge. And so when that kind of thing happens, it just really underscores the dangers of misinformation in the media. And in today's digital age, the social media platforms like Facebook and Twitter are major sources of health information, alongside traditional news media, health websites, and podcasts. But the quality and the accuracy of information can vary, and that makes it essential to approach these sources critically. Right now, we have something called direct-to-consumer advertising out there. And when you have direct-to-consumer advertising, it's the ability for prescription drug companies to directly market to consumers. And so that can increase awareness and encourage proactive health decisions, but it can also raise concerns about overconsumption and the accuracy of the information that's being presented in the ads. So the influence of direct-to-consumer advertising on healthcare costs and patient expectations is really a topic of much debate. You know that there are diabetic medicines that are used for weight loss, and they're over excitement by the media results in overconsumption and misinformation. And so these kinds of things are important to consider when we are navigating the world of healthcare for ourselves, because altogether, media does play a crucial role in shaping our health perceptions and behaviors. And so understanding theories like agenda setting theory, priming theory, framing, all of this can help us recognize media's influence. The speed of misinformation highlights the need for critical thinking and media literacy to navigate health information in a responsible way. So as we encounter health messages in various media forms, it's important to evaluate them critically and make informed decisions about our health. So thank you for joining us with this exploration where we talk about media effects in health.